In the old days, being, 20 years ago when I first started, you shared your message, whether it be traditional newsprint, whether it be speaking to service clubs. It was very static. It was very much, here's what you're going to do. Now, I think all three of those in my experience, and also today, you have to share it differently. This is one of those examples. You got to do it different, but you also have to share it by what's happening right now. How has this changed in now compared to 5 years ago? Mm-hmm. And I work with part of one of my volunteer roles is I work with a fundraising social club. It's Association of Fundraising Professionals, and we work with fundraisers in North Dakota and Minnesota, all volunteer, as to how you share your story better and how do you make a bigger impact with your story. And I think right now what we're doing in Sanford's part, one of them is we're able to go across and talk about, here's what's happening in your small community, small county. Here's exactly what's happening. And how do we share that story better? I talked earlier about the video messages I do, but we also share it through the magic of pictures. We share it through the magic of, here's a testimony that we just got this week, today, right away. And we can do those things now better than we ever can. And that's what's exciting.
Is it companies that you're working with or like larger fundraising groups for that?
It's fundraisers who have like my job.
Okay.
And in varying levels of small organizations, large organizations. Everybody's looking for, how can I share our mission better?
Yeah.
Because there are people excited about what we do, excited about what another group does. If you're not excited about Children's Hospital, I'm not going to make you excited about Children's Hospital.
Yeah.
If you're excited about Edith Sanford Breast Cancer Center, my job is to get you more excited about it. Mm-hmm. How can I connect your interest to giving, to support what you want to support? And that's going to be the challenge for fundraising in at least the next 5 to 10 years is going to be with resources. It's going to be giving. For the first time in a long time, over 2022 and 23, it's the last numbers we have. Nationwide, all charities. Charitable giving actually went down the last 2 years. The percentage of households who give to charity will probably be in 2025 under 50% as a nation for the first time. So what we're finding is people are giving, but they're giving to areas that interest them, which is fine, as it should be. Our mission, again, is how do we share our results? How do we share what we do? And how do we share the area that interests the donor on their time?
Yeah.
Yeah. And so that's why you're seeing things like giving through Venmo, giving through not just online giving, but giving different vehicles out there, donor-advised funds, restricted funds, whatever. That's our mission, is how do we get people excited about that too?
I'm glad that you said that because I was going to ask, what does getting it out there better or more look like? Because I don't think just getting it out there more, getting the message out there more is necessarily better.
Yeah, you have to cut through that noise.
Yeah.
You got to cut through it. And the two ways to do it, there are two parts to this. And this is the world according to Travis. This is not, a national thing. This is my world. I got two things. It's got to be personal. It's got to be, I need to know Sam at OK Tire. Mm-hmm. I know what he does. I know where he is. I know what he's interested in. The second part of this is don't talk in generalities. Don't just be saying, our mission at Sanford is to be the best rural healthcare provider in the country, which it is. And I think we're well on our way. We're going to be the best one in the country. So what does that mean? Well, you've supported, I'll give you an example, Sanford Health Hillsborough, up in Hillsborough, North Dakota. We have a medical center up there. Great people, awesome people. We will tell them, in Trail County, North Dakota, here's what we've done. We've served this many patients. It blows people away. But we'll do things like take a video inside the waiting room in Hillsborough and say, here's what we're doing locally. Here's our mobile mammography truck. Here's what we do here. And this is not Fargo. This is not Grand Forks. This is not Sioux Falls, or name your larger city. It's right here. So the mission has got to be, we're doing all this great work, but how does that impact me in small town Minnesota, small town North Dakota? That's our job.
Yeah.
That's what we need to do. We need to share that better.